friends, you're welcome to Roy Mother Care channel. I'm Rachel, a registered nurse midwife and a certified family planner currently based in Nigeria. I'm also the number one seller at Roy Mother Care stores where I sell newborn essentials, basically everything needed for the care of the newborn, prepacked hospital delivery bags where you have everything needed for your hospital delivery, maternity wears, both casual wears, corporate wears, gift items for new mothers, children items like children's shoes, children clothes, children items basically, and lots more. If you need any of these items, you can contact me on any of my address on the screen. On this channel, Roy Mother Care channel, I talk about pregnancy, motherhood, and parenting. Kindly subscribe to this channel if you haven't subscribed. Please do and click on the notification bell to receive notifications whenever I post a new video. Like the video. Kindly engage me in the comment section. Please leave me comments and share the video. I get asked randomly, Nurse, what causes abortion? What causes miscarriages? One of my sisters had a miscarriage, or I myself had a miscarriage. What causes it? So today we'll be talking about the causes of miscarriage and how to prevent them. So basically, spontaneous abortion or miscarriage, they are the same thing, and I could use the words interchangeably, is known as the termination of a pregnancy before 24 weeks of gestation. So I'm not talking about the pregnant abortion that is done willfully. Probably a lady does not desire a pregnancy and she decides to go terminate it. That's not the abortion I'm talking about. I'm talking about one that happens spontaneously. And there are different types of spontaneous abortion. There's the threatened abortion, inevitable abortion, complete abortion, and missed abortion. In a threatened abortion, there's vaginal bleeding, that is, the woman sees blood come out per vagina, and on pelvic examination, probably by a midwife or a medical doctor, the cervical os is closed. The cervix is the entrance to the uterus, and the uterus is where the baby grows and stays throughout pregnancy. So that entrance, which is the cervix, should remain closed throughout pregnancy till labor sets in. So in a threatened abortion, there's vaginal bleeding, the cervical os remains closed, and on ultrasound, on a transvaginal ultrasound, the fetus is still viable. That is, the fetus is still alive. And one thing common to all types of abortion is that there's usually vaginal bleeding. So the second type of spontaneous abortion is inevitable abortion. In an inevitable abortion, there's also vaginal bleeding, like I said, and on a pelvic examination, the cervical os is opened. That is, the products of conception can come out anytime. It could come out soon, it could come out anytime. And on a transvaginal ultrasound, the fetus is still viable. That is, the fetus could be viable and it could not be. It might be viable or not. The third type of spontaneous abortion is a complete abortion. There's also vaginal bleeding, and all the products of conception have come out. So, this is a total abortion. The fetus is not viable here. And the fourth type of spontaneous abortion is a missed abortion. In a missed abortion, there's vaginal bleeding, and on a pelvic examination, the cervical os is closed, although some tissues could have come out. And then on an ultrasound, the fetus is not viable, and there could still be products of conception remaining. So a manual vacuum aspiration could be done to remove the remaining products of conception. Now, what are the symptoms of an abortion? There's usually vaginal bleeding or spotting. So, usually, if you're pregnant and you see bleeding per vagina, it might not be normal. You should visit your doctor. Then, another symptom of abortion could be a lower abdominal pain or a lower back pain. Although this could also happen normally in pregnancy, it could be as a result of the position of the fetus, but it could also be as a result of abortion. Also, there could be fluid, passage of fluid or tissue per vagina. So these are some of the symptoms of abortion. Now, let's talk about the causes of abortion. The first cause of abortion I'll mention is chromosomal abnormalities. This is a very common cause of spontaneous abortion, and chromosomes contain genes that determine the genetic makeup of an individual. So if there's any abnormality with this chromosome, either wrong number, either they are in excess or they are in a reduced number or they are damaged, it causes chromosomal abnormalities. And usually it is seen in women that are of older age. They usually have this they usually experience this. They usually have children with chromosomal abnormalities. And chromosomal abnormalities could be hereditary, that is, it could be inherited, or it could be spontaneous. It could just happen. And a common example of chromosomal abnormality is Down syndrome. Usually, an anomaly scan is usually done in pregnancy, like a routine ultrasound during antenatal between 18 to 21 weeks to detect if there's any abnormality with the fetus. And this brings me to the next point, which is age. Older age, usually it predisposes a woman to risk of having miscarriages. So a woman above the age of 35, 40, conceiving could predispose her to having a miscarriage. So the third cause of abortion that I will mention is maternal condition. Any condition that affects the mother, it could be an infection, yes, like rubella or cytomegalovirus, could cause a miscarriage. Also, health conditions of the mother, like poorly controlled diabetes, high blood pressure, severe kidney diseases, could lead to a miscarriage. Also, hormonal imbalances like women with PCOS, polycystic ovarian syndrome, are likely to have miscarriages. Also, if there's any problem with the uterus, like an abnormally shaped uterus or cervical insufficiency is when the cervix, which is meant to remain closed throughout pregnancy, begins to widen or open early in pregnancy or at the middle of pregnancy, could lead to a miscarriage. Also, sexually transmitted diseases or infection like gonorrhea, syphilis could also predispose a woman to miscarriages. Also, previous history of miscarriages, that is, a woman who had miscarriages before, could also be at risk of miscarriages in a later pregnancy. Conditions, another thing that could cause a miscarriage is immune system disorders in the mother. For example, lupus and or thyroid diseases. Lupus is when the immune system of an individual is fighting against itself. It could lead to a miscarriage. Also, ectopic pregnancy could cause a miscarriage. That is when there's wrong implantation of the fertilized egg. It could implant anywhere in the abdominal cavity that where it is not meant to implant, and this could lead to a miscarriage. The fourth cause of miscarriage I would like to mention is maternal lifestyle. Weight of the mother, like obesity, if the mother is underweight or overweight, it could lead to a miscarriage. Also, smoking, the mother could also be a secondary smoker. She might not be smoking directly, but probably the father is smoking and she inhales it, it could also cause a miscarriage. Or illicit drug use could also lead to a miscarriage. Malnutrition and various things that affect the mother's lifestyle could cause a miscarriage. The fifth thing I would like to mention is environmental hazards. When a mother is exposed to radiations or toxic, harmful chemicals in the environment, it could cause a miscarriage. Such chemicals include lead, mercury, or paint thinners, and the likes. This could cause pesticides, could also cause a miscarriage. The sixth thing is or are medications. When you are pregnant, you should not use drugs anyhow. Some drugs are harmful in pregnancy. Then you should be careful of just buying over the counter medications. You should visit your doctor or your midwife whenever you have any issues with pregnancy. So you could be sure, like ibuprofen, painkillers, or drugs used for inflammatory processes are not safe in pregnancy. The next cause of miscarriage I would like to mention is food poisoning. For example, food poisoning from salmonella, which can be seen in raw or undercooked egg. Yes, toxoplasmosis, which can also be gotten from infected raw meats, can also cause miscarriages. What does not cause miscarriages? Number one, exercises, minimal moderate exercises do not cause miscarriage. Like just taking a walk, jogging does not cause miscarriages. Intercourse during pregnancy does not also cause a miscarriage. Then walking. Pregnancy is not a sickness, it's not a disease. You can still go about your normal daily activities so far they are not so strenuous. It doesn't stop you from walking, so it can't cause a miscarriage. Taking spicy foods too do not cause miscarriages. So now let's talk about how to prevent miscarriages. Number one is prenatal care. Even before conceiving, for every young lady in a reproductive age should begin preconception care. So this involves taking daily folic acid, visiting your doctor for assessments and for checkup. The next thing is attending prenatal or antenatal care. During pregnancy, it's advised and it's very good you attend your antenatal care so you are assessed and you are always checked. The third one is to take your multivitamins, to take your routine multivitamins in pregnancy. Although there's no sure way to prevent miscarriages, but you can do these things to ensure you have a healthy and safe pregnancy. So, have regular preconception checkup or preconception care. For young ladies in their reproductive age should begin preconception care. Then attend prenatal or antenatal care regularly. This will help to detect and begin early treatment if there are any issues. So, if you are pregnant, you should ensure you do not miss your antenatal visits. Then avoid the known causes of miscarriages. Maintain a healthy lifestyle. Avoid smoking. Limit alcohol intake. And then illicit drug use. Maintain a healthy weight. Eat adequate diet. Eat well. Then also take your daily multivitamins. The routine multivitamins you're given during pregnancy, ensure you take them and take them consistently. Then, if you have any chronic health conditions, ensure you are visiting your doctor so they can be properly managed so as to prevent miscarriages. We have come to the end of this video. We've been able to learn the types of miscarriages, the causes of miscarriage or spontaneous abortion, the symptoms, how to prevent them, and what the things that do not cause miscarriages. So, if you have any questions, you can leave it for me in the comment section. If you have any contribution, if you have anything you need to clarify, you can drop it for me in the comment section. Kindly engage me in the comment section. And please share this video, like, and subscribe. Thank you. Stay safe, stay blessed. Bye.